Welcome to this deep dive. Today we're tackling something really crucial, but maybe a bit overlooked. The unique staffing challenges facing mental health facilities.
Exactly. We often hear about the dedication of mental health professionals, right? But what happens when the very places designed to offer that crucial support, well, they struggle to find enough qualified people.
Yeah, it's a huge challenge.
It's really widespread in mental health right now, and it directly impacts the quality of care for people who, frankly, need it most.
That's exactly right. You see it everywhere, from inpatient units, community centers, even substance use programs. This persistent difficulty in actually attracting and retaining staff, it has real consequences for client outcomes.
Yeah.
It's not just some admin headache. It's fundamental to delivering effective care.
Okay, so in this deep dive, we want to go beyond just, saying there's a problem. We're aiming to pull out concrete, actionable strategies that mental health facilities can actually use to tackle these staffing shortages head on. Our mission really is to give you a clear grasp of the key insights, the practical approaches that work, things that lead to better staffing and, ultimately better lives for clients.
Kind of a shortcut through the complexity.
Exactly. Think of this as your direct route to understanding what truly works. Okay, so let's unpack this. A really basic piece seems to be how these places are even looking for staff. It can't just be like posting a general healthcare job ad, right?
No, absolutely not. That general approach, it often just doesn't yield the right results in mental health.
Why is that?
Well, the specific skills, the mindset, the deep understanding needed, it's pretty distinct. What we see working much better is when facilities really tap into candidate pools that are specifically geared towards mental health pros.
Okay, interesting. So where are they finding these people, like specific places?
Yeah.
And is it really making a difference compared to just using, say, Indeed or something?
Yeah, it is. The data backs this up. Professional associations are a prime source. Think organizations like the APA, the NASW, the APNN.
Right, the big ones.
Exactly. They all have active job boards, networking events, facilities that really engage there. They report getting higher caliber applicants, people genuinely invested in this field. There was one study I recall showing over 40% of clinical psych hires in specialized settings came directly through APA resources.
Wow, okay. 40%? That's pretty compelling. It really shows the value of going where those specific professionals gather.
Definitely.
And it sounds like maybe connecting early in someone's career path is also smart.
Precisely. Those partnerships with university programs, counseling, social work, psychology, they're proving really valuable.
How so?
Well, by offering internships, clinical rotations, engaging with students early, facilities build relationships, they get known, they can even help shape training a bit to meet their needs. It creates this direct pipeline of potential staff who already kind of know the facility's mission, its values.
That makes a lot of sense. Get them in the door early. But, beyond the paper qualifications, the degrees and licenses, it strikes me that assessing if someone is truly suited for this kind of demanding work needs something more nuanced.
You're absolutely spot on. The sources really stress screening for what they call temperament and sustainability factors.
Okay, tell me more about that.
It means looking beyond the CV, essentially. Evaluating things like emotional resilience, how well someone manages boundaries, which is crucial in this field, and whether they have a realistic grasp of what the work actually involves day to day.
And how do you assess that realistically in an interview?
This is where it gets interesting. They highlight using behavioral interviewing techniques.
Behavioral interviewing.
Right.
Right. Remind me how that works in this context.
So instead of asking hypotheticals like, what would you do if, you ask for specific examples from their past. Tell me about a time you dealt with a really challenging client interaction, or describe how you managed a stressful caseload. The idea is that past behavior is a pretty good predictor of future performance. It gives you much richer, more concrete data on their actual skills and coping mechanisms compared to just talking theories.
That feels much more revealing, yeah, seeing what they've actually done.
Yeah.
And what about the message facilities put out there to attract people? Does the recruitment pitch itself matter much?
Oh, massively. The messaging has to strike a careful balance. You obviously want to highlight the mission, the dedication to clients. That's key.
Sure.
But it's just as vital to communicate how staff are supported. Are there clear paths for professional development, opportunities to grow? Is there a real commitment to work-life balance? You need both sides of that coin to attract and keep people who are passionate but also won't burn out.
It's like a two-way street, isn't it? Staff support clients, the organization needs to support the staff.
Exactly.
Now, thinking about today's job market,
Yeah.
speed seems critical. Facilities probably can't afford super long hiring processes.
No, they really can't. The sources hammer this point home.
Right.
Expedited hiring is crucial. Streamlining application reviews, doing interviews promptly, getting offers out quickly. Otherwise, you lose good candidates to competitors.
Right.
Some places are even using conditional offers, offer pending background checks and credential verification just to lock in promising people faster.
Okay, so find the right people through targeted channels. Assess them thoroughly for skills and resilience using behavioral questions. Give them a compelling reason to join that includes support, and then act fast. Makes sense.
That's a good summary.
All right, so once you've got these talented folks on board, how do you make sure you're using their skills in the best way? This is where those innovative staffing models come in, I guess.
Exactly. The recommendation is always to first take a hard look at your current staffing. Really figure out what's working well, but more importantly, where the inefficiencies are.
Okay.
Once you've done that diagnosis, you can look at implementing newer models. And a key one is tiered staffing.
Tiered staffing. Can you break that down a bit? How does it look in practice in a mental health setting?
Sure. So tiered staffing is basically about strategically using professionals with different credential levels. For example, your highly credentialed folks, psychiatrists, licensed clinical psychologists, they focus on the complex stuff.
Right.
Detailed assessments, treatment planning, specialized therapies.
Right, the high-level clinical work.
Exactly. Then maybe your bachelor level staff can effectively run therapeutic groups, facilitate skill building sessions, handle routine client monitoring.
I see.
This way, you maximize the impact of your most highly qualified staff, stopping them from getting bogged down in tasks others can do well, and it also creates natural career pathways for people entering the field.
That sounds much more efficient, using everyone to their best potential.
It is. Another model gaining traction is hybrid scheduling.
Remote work in mental health.
To an extent, yes. While obviously a lot of client interaction needs to be face-to-face, many other essential tasks can be done remotely. Think documentation, clinical supervision, team meetings, even some types of therapy sessions.
Okay.
Offering that flexibility can be a huge plus for recruitment and retention, especially for specialists who might really value that improved work-life balance.
Yeah, that flexibility is a big draw these days across the board. What about covering gaps like unexpected absences? How do facilities manage that without just calling in expensive agency staff who don't know the place?
That's where developing internal float teams comes in. These are your own staff members, cross-trained to work across different programs or units.
Like internal relief staff.
Precisely. So when there's an absence or maybe a temporary spike in needs somewhere, you deploy them. The big advantage over external agency staff is they already know the culture, the charting systems, the treatment approaches. It's much smoother, much more consistent for clients.
That makes total sense. Keeps that internal knowledge and consistency. You also mentioned mixed experience teams earlier. What's the thinking there?
The idea is simple but effective. Intentionally pair experienced staff with newer professionals on teams or shifts.
Instead of grouping all the veterans together.
Exactly. Spreading out that experience fosters ongoing informal mentorship. Newer staff have someone right there for consultation, for support. It improves care quality immediately through shared expertise, and it creates these natural development opportunities within the team. That can be a really attractive feature for recruitment and helps people stick around longer.
It's like building mentorship right into the daily workflow.
Smart.
Okay, shifting gears slightly. Credentials. Managing licenses, certifications, compliance, that always seems like a potential nightmare in healthcare. How are places tackling that?
Yeah, it can be incredibly complex. The sources really point to the benefits of centralized credential management systems.
Digital systems, presumably.
Yes, digital platforms. They let you track everything systematically. Licenses, certifications, required trainings, all the verification documents. And crucially, they track expiration dates.
And flag them up?
Right. Automated notifications go out to staff and supervisors well before renewal deadlines. It massively reduces the risk of someone's credentials accidentally lapsing, which can be a huge issue.
Sounds like it takes a huge administrative weight off.
Yeah.
But it's not just tracking, right? It's also about making sure those credentials are legit in the first place.
Absolutely. That's where primary source verification comes in. establishing direct relationships or using services that connect directly with licensing boards, certification bodies, universities.
To check directly with the source.
Exactly. You're not just relying on the piece of paper the applicant gives you. You or your partner service verifies it directly with the issuing body. And good systems often include ongoing monitoring checking for any disciplinary actions or status changes after the initial hire.
So it's continuous assurance, not just a one-time check.
And related to that is ensuring staff actually have the required skills. The sources talk about standardized competency assessment frameworks.
What does that look like? Not just asking questions.
No, it's more practical. It means defining the core competencies needed for each role really clearly, and then using consistent tools to assess them. Things like clinical simulations, maybe standardized patient scenarios, or direct skill demonstrations.
So seeing them do the job, essentially, in a controlled way.
Exactly. It gives a much more reliable picture of their actual capabilities than just relying on interview answers or self-reports. Helps ensure a consistent standard of care.
Okay. So we've covered internal strategies, recruitment, staffing models, credential management. But it sounds like looking outward for partnerships is also really important.
Oh, definitely. Especially in a specialized field like mental health. These external collaborations can be incredibly valuable. Think about specialized staffing agencies.
Ones that focus just on behavioral health.
Yes. They have established networks of qualified professionals. They understand the specific credentials and experience needed. They often have really effective screening processes tailored to the field. They can help with temporary gaps, supplemental staffing, even temp-to-perm hires.
So it's like outsourcing some of that specialized recruitment effort. What about building the future workforce pipeline?
That's where partnerships with educational institutions are vital. Building strong ties with university programs, counseling, social work, psych, nursing for internships, clinical rotations, practicums.
Getting students exposure.
Right. And some facilities go further, offering things like tuition support or loan repayment programs in exchange for a commitment to work there after graduation. It's a direct investment in creating a future talent pool.
That's a great long-term strategy. And I imagine partnerships for ongoing learning are important too, keeping skills sharp.
Absolutely. Collaborating with training organizations, certification programs, continuing education providers, that's key for both recruitment and retention.
Oh.
Well, these partnerships can bring customized training right on site, tailored to the facility's needs. They might negotiate group rates for external courses, or even share costs for specialized education. It makes it easier and more affordable for staff to maintain credentials and learn new skills, which is a big plus.
Fostering that culture of continuous learning. Okay, we can't wrap this up without talking technology. How is tech helping with these staffing headaches?
Tech is playing a bigger and bigger role. Scheduling optimization software is one key area.
Making the rotas.
Yes, but much smarter than just filling slots. These systems consider staff certifications, client needs, continuity of care, staff availability, even preferences to create more efficient and equitable schedules. Some advanced ones even use AI to analyze patterns and predict future staffing needs.
Wow, that could save a lot of admin time and maybe reduce burnout from bad schedules. What about reaching more people, especially specialists?
That's where telehealth comes in. It's not for everything, of course, but it allows a lot of assessment, therapy, consultation to happen remotely.
Breaking down geography.
Exactly. It extends the reach of specialists, which is huge for rural areas or places lacking certain expertise, like maybe child psychiatrists or experts in specific therapies.
Makes sense. And finally, the dreaded paperwork. Documentation?
Tech is helping there too. Things like voice recognition software for dictating notes, template libraries to speed things up, even AI-powered documentation assistants are emerging.
Anything to reduce that admin burden.
Right. By streamlining documentation, these tools free up clinicians to spend more time on actual client care, which improves both productivity and job satisfaction. Less time typing, more time helping.
So it's really clear that there's no single magic bullet here. It's this combination: specialized recruitment, rethinking staffing models, managing credentials tightly, building partnerships, and leveraging technology.
Exactly. It's a multifaceted approach. The sources emphasize that forward-thinking organizations aren't just accepting staffing gaps as inevitable, they're actively investing across all these areas.
They're being proactive, building solutions.
Yes. investing in both immediate needs and the long-term development of a skilled, supported workforce.
And ultimately, that proactive investment pays off, right? It leads directly to better quality services, more stability for these vital organizations.
Couldn't agree more.
So, as you've been listening to us unpack all these different strategies, here's something to think about. What single innovation out of everything we've discussed do you think could make the biggest, most immediate positive difference to mental health staffing right where you are in your community? Definitely something worth pondering.